This morning on CBS 6.
This segment is sponsored by Bon Secours.
Well, this year alone, more than 300,000 women in the U.S. are expected to be diagnosed with breast cancer. We all hope to never have to face this diagnosis, but what do you do when you find a lump? What's next? Dr. James Pellicane with Bon Secours Virginia Breast Center is here with the answers and insight on new developments in treating breast cancer. Doctor, it's great to see you.
Thanks, Jessica. Good to be here.
This is an important topic of conversation. Of course, October, Breast Cancer Awareness Month. We see these headlines in the news. It seems like diagnoses happen all the time. We have someone in our studio right now on our team who you work with folks every day and you never know what they're going through. And she's navigated this path, but it's different for everyone, isn't it?
Very different. It's not only different for every individual, but every diagnosis of breast cancer is different. They're treated differently, diagnosed differently. It's an exciting field at the same time.
And you raise a great point. Every case is different, and that's what makes it so really confusing I think, for women, because we hear different standards in terms of when to get mammograms and what to look for, and then it happens at different ages. Bon Secours Virginia Breast Center is a new comprehensive approach, really, to facing some of these answers.
It really is. We opened in 2005 and really were at the time the first breast-only surgical center. In 2008, we affiliated with Bon Secours and really have been able to expand our footprint throughout Central Virginia. So we're affiliated with Bon Secours. We're connected usually to the Women's Imaging Center, so it's a true one-stop shop for women.
I have this conversation with girlfriends all the time. When is the right time to start approaching that mammogram, and what should you be looking for? And the self-checks, how important are they?
So we still maintain the standard recommendations. First mammogram at age 40. You should be screened sooner if you have a family history of breast cancer. If your first-degree relative was young, it would be 10 years prior to their diagnosis.
There are new approaches today than there were 5 years ago, 10 years ago, in terms of how to use radiation and chemotherapy.
The whole paradigm's really shifted in breast cancer. So decades ago, we were always trying to identify the 2 or 3% of women that would benefit from more aggressive therapy. What we're doing now is really personalizing medicine more. And what we're finding is that women who generally, with invasive breast cancer, who we would have considered high risk in the past when we use new genomic tests, specifically a test called MammaPrint. When the genomic tests or the genetics of that breast cancer, or the biology of that breast cancer is low risk, we're able to save probably 46% of women chemotherapy. So women who otherwise would have been recommended to get chemotherapy don't benefit from it. So we're saving a lot of women the trials and tribulations of chemotherapy. And the same even with ductal carcinoma in situ, which is a very early breast cancer, non-invasive breast cancer, but typically treated with surgery and radiation. We have a new genomic test now called DecisionRT, where we can look at the biology of that cancer and save a lot of women radiation. So.
We said at the beginning, when you find a lump, what do you do? Oftentimes, you may be going in for routine tests, routine checkups, right? You have that first mammogram and it's discovered you've never seen a lump, but what do you do?
So there's two issues there. There's when you feel a lump and then when you find something on a screening mammogram. When you feel a lump, for a young woman, if they have a history of breast cysts, you can usually let it go through one cycle if your risk tolerance allows you to. But otherwise, just call us. Call Virginia Breast Center, come in. We see women with breast lumps all the time. We examine them. We might do an ultrasound on them generally in the office. Most of the time, it's going to be nothing. It's going to be a cyst, but sometimes it's not. It's something that we might need to biopsy. On a screening finding, you'll generally be called back for additional views, whether they're magnification views or what we call compression views and an ultrasound. And then we go from there if patients need biopsies.
You mentioned, there's a difference in perspective in terms of targeting things based on age to some degree. The Virginia Breast Center has created an adolescent breast health program. So what is this? So,
adolescent women have breast problems as well, and it's something that isn't always talked about. What we've started is an adolescent breast health clinic. It's run by our nurse practitioner, Ida Vaklovic, and the problems are generally non-surgical. They're usually breast pain. They could be nipple discharge. problems that younger women are just embarrassed to talk about. But we try to do that in a comfortable environment for them. Sometimes they need surgery if they develop a breast lump. The most common breast lump an adolescent's going to form is a breast lump called a fibroadenoma, which is the most common breast tumor we see across the country, but they're benign. And we're able to remove them surgically. We do the surgery a little different. You know, we hide the scars, we put the scars underneath the breast, and so these young women get their breast lumps removed and don't have to spend the rest of their life with a visible scar on their breast.
And it seems particularly progressive to start taking this approach of targeting when women are younger, when females are adolescents, because in days of yore you would just wait, or they weren't addressed.
They weren't addressed or they were ignored. And so it really is brought to the forefront the importance of breast health and being aware of your breast and getting screening when you need it, and getting biopsies when you need it, and not getting biopsies when you don't need them, even more importantly.
Dr. James Pellicane kicking off Breast Cancer Awareness Month with us. Thank you so much for being here. We're going to share some information. The Bon Secours Virginia Breast Center has 3 convenient locations: the Watkins Center in Midlothian, St. Mary's Hospital in Richmond, and Memorial Regional Medical Center in Mechanicsville. For all the information and to schedule your appointment, call 594-3130 or visit the center's website. It's vabreastcenter.com. Right now, we're going to send it over to Cheryl. She's in the Virginia This Morning kitchen with some stew.
Yeah, thank you, Jessica. Over here,